Chapter 21 is all about blood vessels. So both identification of arteries and veins throughout the body, as well as physiology. So let's take a look at the chapter topics. First thing we do is look at the tissue differences between blood vessels. So we'll compare arteries, veins, capillaries, and compare their layers of the wall of the vessel. So the layers of the wall are known as tunics, and each of these layers have different types of tissue. So we're going to compare the differences at the tissue level. We'll then talk about the different types of capillaries. You don't just have one type of capillary because there has to be different permeabilities. Permeability is how easy something can go in or out of the blood vessel. So in some places we need to have more permeability where we can get more things in or out of the blood vessel, and then in other areas we have what we call tight capillaries, where the permeability is low and things can't enter or exit the blood as easily. Then we're going to get into the major systemic arteries, the major systemic veins. We'll talk about a couple special circulations. One is known as the hepatic portal system, where we send blood to the liver. And then we'll talk about fetal circulation. That's a special circulation because a fetus isn't breathing, so how does it get oxygen and get rid of the carbon dioxide? Then we'll talk about pulse points. Those are arteries that we can feel and palpate and determine heart rate. We'll talk about how we measure blood pressure. And then we'll get into a lot of the physiology comes towards the end of this PowerPoint. So we'll talk about blood flow, blood pressure, blood velocity, a concept called vascular resistance, capillary exchange, so how things enter and exit at capillaries, and then venous return, which is the return of blood to the heart in systemic veins. And then we wrap up focusing heavily on blood pressure and how the body controls blood pressure. Okay, so let's just introduce blood vessels. So I think we already know the basic differences between arteries, capillaries, and veins as far as direction of blood flow and whether they allow exchange to occur. We're focusing primarily on the systemic circuit. So don't forget the pulmonary circuit, pulmonary arteries delivering deoxygenated blood to the lungs, pulmonary capillaries doing gas exchange, and then pulmonary veins bringing the oxygenated blood back to the heart. But we're focusing heavily on the systemic circuit, where systemic arteries are oxygenated, capillaries deliver the oxygen, pick up carbon dioxide, as well as deliver nutrients and pick up waste, and then we bring that blood in back to the heart in the systemic veins, which their destination is the right atrium. So this is a drawing of a blood vessel describing the different layers. These layers are called tunics. So we have the tunica externa, or the outer layer, the tunica media, or the middle layer, and the tunica intima, or interna, being the inner layer. Basically, the outer layer is mostly connective tissue, so this tunica externa. The middle layer is where you're going to find a lot of the elastic connective tissue and the smooth muscle. And then the inner layer is an endothelium, which is an epithelial layer of simple squamous. There's also what's called the basement membrane. So that's the basic difference in these three layers, and then we're going to just compare the different types of blood vessels. So we start with arteries. We know the function, carry blood away from the heart. There's two general types of arteries. The ones closest to the heart are getting that extreme change in blood pressure. So they're known as elastic arteries. They need to have more elastic connective tissue to withstand that fluctuation in blood pressure. So a good example of an elastic artery would be the aorta, because it is closest to that source of pressure being the left ventricle. As we move away from the aorta, the blood vessels are known more as muscular arteries because they have a significant amount of muscle in order to distribute more or less blood to the destination. So for example, if you're exercising, you need the arteries going to your arms and legs to dilate so you can send more blood to those muscles. When you're not exercising, you want those arteries to constrict and decrease blood flow. So we kind of start off as an elastic artery, and then as we get closer to the destination, the organ or the body region, they're known as muscular arteries. So if you compare the two, just briefly, this is an elastic artery, and it shows a thicker layer of elastic connective tissue within the tunica media, whereas this is a muscular artery which shows less elastic connective tissue and a more significant amount of smooth muscle. Then we get to the arterioles, and recall that an arteriole is just a microscopic artery. It's going to have similar properties in that there's going to be smooth muscle to dilate and constrict. There is also going to be some elastic connective tissue. The capillaries really just have the tunica interna or intima, and of that it's really just an endothelium and then a little bit of basement membrane, which is just a little bit of connective tissue. And the reason we don't want any of the other tissues is this is where we need to get things in and out of the bloodstream. So that wall of the capillary has to be very, very thin. So it's just a single layer of flat cells surrounded by a little bit of connective tissue called the basement membrane. Then we go to venules. And a venule is a small vein, so it's going to have the same function. We're going back towards the heart. The veins, if we compare veins to arteries, are going to have much less elastic connective tissue in the tunica media because they don't have to withstand that fluctuation in pressure. They're going to have less muscle because they don't distribute more or less blood to an organ. Now they do have muscle in order to dilate and constrict, and one reason is we want more blood to, say, be found in the veins of your arms and under the surface of the body so you can remove heat from that blood. So there is muscle but less muscle. There is connective tissue but less connective tissue. And notice what veins have. They have valves. So those valves are going to help that blood flow back towards the heart and prevent backflow. The reason is pressure. The pressure in the veins is much lower than pressure in the arteries. And there's not much of a difference between these smaller or medium veins and the larger veins. So there's a lot of information on these drawings, but what I want you to focus on is the difference in the muscle and the elastic connective tissue in the different blood vessels. And again, that's largely based on whether you have high pressure, like arteries, or low pressure, like veins, and whether you have to distribute more or less blood to a body part. So down here are the key properties of arteries. They have elasticity to stretch and recoil in response to high then low pressure. And then they have contractility, using that smooth muscle to constrict and dilate. And we call that vasoconstriction and vasodilation. So that property is very important for regulating blood flow as well as blood pressure. And I want to point out this right here. Arterioles have the greatest impact on overall blood pressure. The reason is you've got so many little arterioles. So when these little arterioles dilate, that can lower your blood pressure. When these blood vessels constrict, that can help raise your blood pressure. Capillaries. Capillaries obviously are very important for allowing exchange but we can also regulate blood flow into and through the capillaries. So this diagram is to show you that there are what's known as precapillary sphincters. So precapillary sphincters are little rings of muscle that surround the capillaries and just before the capillaries. So this is called a meta-arteriole. We don't need to go there, but notice that we've got this smooth muscle that can dilate, and then these sphincters can relax, and that opens up all these capillaries. So if this tissue here needs a lot of oxygen and nutrients, we can increase the blood flow through it. So for example, this would be an exercising muscle tissue. Then if we stop exercising, right, those muscles don't need that large blood flow anymore, so we can constrict the arteriole and we can constrict the precapillary sphincters and decrease the amount of blood flowing through these capillaries. All right, so that's one level of blood flow regulation that occurs at those capillaries. Okay, so let's continue to talk about capillaries and look at the different types of capillaries. This drawing shows three. There's actually a fourth type called the blood-brain barrier. If you recall from A&P 1, you've got a specific type of neural glial cell called the astrocytes that surround the capillaries and help protect that brain tissue. So those are a capillary that's considered to be a tight capillary. It has very low permeability. That way your brain is protected in case there's something in the bloodstream that might be toxic. The other three types are the continuous capillaries. They're the most abundant. Things can go in or out of the bloodstream, so this would be the inside of the capillary where the red blood cell is. Molecules can go right through the cell. They can go kind of in between the cell. This is known as an intercellular cleft. So these are found in skin and muscle, and they're kind of your general capillary. If we need more permeability, so we need to get more things out of your blood or into the blood, we might use what's called a fenestrated capillary. A fenestration is a hole. So notice the endothelial cells have these little holes in there. So that allows a higher amount of movement in or out of the capillary. And I want to focus on kidneys. Kidneys have these fenestrated capillaries because one of their jobs is to filter waste from the bloodstream. And in order to do that efficiently, the capillaries are fenestrated, so we can remove more waste from that bloodstream. Small intestine and endocrine glands, I'm not going to ask you about that, but I think since we know in general what a kidney does, filters blood, it should make sense that it has fenestrated capillaries. The next type are called sinusoid capillaries, and these have larger holes. So the fenestrations are larger, and that allows even bigger things to either go into the bloodstream or come out of the bloodstream. So I want to talk about liver, spleen, and bone marrow as being organs that have sinusoid capillaries. Liver produces a lot of proteins, and those proteins are fairly large, too big to go through these smaller holes, so you need larger holes. So the proteins are made by the liver, and then they get put into your circulation through these sinusoid capillaries. The spleen, if you remember, removes red blood cells. Right? So when these red blood cells get old and worn out, they have to come out of the bloodstream. So you need bigger holes to get those red blood cells out of circulation so you can remove them. And then bone marrow produces red blood cells and white blood cells and platelets. So those things have to enter at sinusoid capillaries. And then finally, again, we have that blood-brain barrier that you learned about in A&P 1. Astrocytes make them less permeable in order to protect the brain. The downside of that blood-brain barrier is if we want to design something to get into the brain. Let's say we're designing a new medication for maybe schizophrenia, or maybe we want to treat a brain infection and we're developing an antibiotic. It needs to be able to cross that blood-brain barrier in order to get into the brain tissue. Okay, so these are the 4 types of capillaries, largely based on differences in permeability. All right, the ability to enter or exit the bloodstream easily. All right, so we're going to probably start a new video on the systemic arteries, but just as an introduction, remember your systemic circuit you can think of as starting on the left side of the heart, so the left ventricle, for example. That blood enters the aorta, so that's going to be your first and largest systemic aorta. And then off of that aorta are systemic arteries. And these systemic arteries are all named based on either a body region that it's found in, or a location. Maybe it goes under the clavicle, so we'll name it based on that. Or it's delivering blood to a particular organ. So for example, maybe it's delivering blood to a kidney, so we'll call it the renal artery. So these are all oxygenated arteries coming from the aorta, going to a final destination where they will form arterioles, then capillaries, and deliver that oxygen, pick up carbon dioxide, deliver nutrients, and pick up waste. Then, once we learn all these arteries, we'll move on to the systemic veins, which are bringing that blood back to the right atrium. So next video, we're going to start at that heart and just go throughout the entire body in these systemic arteries.